Hello and welcome to yet another episode of Public Conscience on Radio, the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with the mandate to promote good governance, participation, and accountability in Nigeria. I'm Okiri Agbonsuremi, and Adaobi Obiabumo is right here with me.
I'm glad to be here. Welcome to the program. On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government's attention for democratic actions against it. We are supported by the MacArthur Foundation.
Following the effects of the nation's dwindling revenue, the federal government cut down on the 2020 budget for the health sector by almost 50%. The health budget, which was initially agreed by the federal government and the stakeholders to be 15% of the total budget, has been reduced to about 7% of the nation's total budget.
In figures, this meant a cut from 44.4 billion naira down to 25.5 billion naira. The federal government pinned the cause of this cut to the following: 1. Dwindling oil sales, the crash in global oil prices, and the impact of the coronavirus pandemic.
And there was a loud cry from across Nigeria, the citizens, because this was the time the increase in the investment in the health sector should have been done. And you know, the COVID-19 episode is still playing.
The Nigerian Medical Association, NMA, said the cut will affect the following: immunization, child care, maternal health care, family planning services, doctor-to-patient ratio, which will reduce from 1 to 6,000 to 1 to 10,000.
The public outcry, which drums up the doctors' concerns, is in sync with the criticisms that the huge budget for the renovation of the National Assembly was still retained, though slightly reduced to 27 billion naira from the original 37 billion, in clear neglect for the proper funding of the nation's health sector. One would have expected that they will reduce the costs and move funds to areas where they are actually mostly needed. And if you ask me, the health sector is begging for it.
One of the immediate demands by the doctors, and which is one of the outcomes of the low investment in the health sector, is the inability of the government to fund and provide adequate and appropriately the personal protective equipment, PPE, for all the healthcare workers in Nigeria.
Reports say, and we have doctors in the house who would confirm, that nearly 1,000 medical workers are already being affected by the COVID-19 in Nigeria as at the last count.
Remember that you can follow us on our social media platforms at official PRIMOG. PRIMOG is spelled PRIMORG. Watch our videos on PRIMOG TV. That is our YouTube channel. Please subscribe to get reminders when we have a new post. You can also send your message to our phone number 0902 265 6167. That is 0902 265 6167. You can begin to send your messages now.
Yes, please begin to send messages to 09022656167. Like Ada said, it is just for messages only. We are blessed with two medical doctors in the house. Of course, it has been part of us to bring in professionals because we don't know much of the details, and they will be able to trade with us here, and for you to also join in the course of time to contribute to the discussions. Of course, the health affects everyone. We are all affected. I saw clips of those who thronged the hospitals yesterday who couldn't find anybody to attend to them, and it is one that is serious. Dr. Henry Ewunonu is the head National Advocacy Committee of the Nigerian Medical Association. He's joining us on the program this morning. Thank you so much for joining us.
Thank you for having me. Good morning, listeners.
And we also have Dr. Ejike. Dr. Ejike Oji is a medical practitioner, but he's on the side of development. He's also doing development as a way of also promoting good health around, as well as combining it with his practice of medicine. Thank you so much for joining us, sir.
Thank you.
Now, let me ask Dr. Ejike, what is the relationship between funding and effective management of healthcare services in Nigeria? We are talking against the backdrop of the gap in health funding in Nigeria.
Funding, if you look at the key elements of healthcare, I like to disaggregate them into 5 different areas. One is leadership, the other one is governance, and then the other one is the people who do the job, that is the workers who do the job. And then, of course, the monitoring and evaluation of the work you do. Then central to all of this is funds. Funds. So when I say central, if you look at everywhere in the world where you have great healthcare, the most significant thing is that their healthcare system is funded. No country, and I want to underline, no country can fund healthcare very well unless you use the strategy of pooling funds, insurance. So what it means is that every single person that can earn an income contributes. In a place like Germany, I worked in Germany for 9 years. While I was there, every single person that earns an income, 12% of his salary is taken away and put in the healthcare fund. And that meant there was enough money to fund. That's why Germany is one of the countries that have very wonderful funding. Same in almost all European countries is through the healthcare insurance. Now, if you go to England, the same. The
everywhere.
National Health
That is serious.
Service of England is predicated on pooling of resources and funding through it.
Have we tried to do this?
In Nigeria, yes. I was part of the young foot soldiers of late Professor
Itayo Lambo.
Not the Itayo Lambo. The guy that was
NHIS?
No, he wasn't an NHIS. He was the first person that put the committee together to look at. Itayo Lambo was the minister at the time, but the gentleman is a professor. Is a doctor who was a traditional ruler in Owerri area.
Okay.
If you remember his name. So we were his foot soldiers when the healthcare insurance in Nigeria was being put together in the 90s. You get the point. So what at that time, as a young person, I schooled in Nigeria and I schooled in England, and I had just started working in Germany, and I saw the importance of pooling resources. So we were like small boys annoying our older people.
Without the energy to work.
Yes, annoying our older people. Say, if we have to get this right in Nigeria, this is where we have to go. And they bought into it. So the National Health Insurance Scheme was put together. But unfortunately, why the thing is not running well is that we have been bedeviled in putting the wrong people in the affairs, the people who will run the affairs of those organizations for many years.
We politicized it.
Yes, we politicized it. Another thing is that the guidelines were not properly done in such a way that people will be held accountable. And then, if you notice what happened recently, there was the last minister had a running battle with the executive director or executive secretary of the National Health Insurance Scheme. I will report to you. I don't report to you. I report to the presidency. I don't report to the federal minister of health. So you see, those are the governance issues that I'm talking about. On the large scale, we have taken a decision. We should have an insurance scheme. When it comes to the issue of governance, implementation becomes a major issue, and that's why we are still grappling with the issue. There has been an attempt to change the act. I was part of that attempt to make it much more feasible for people to get care. As we speak, almost 3 or 4 billion naira is trapped in the National Health Insurance account, because by act that money cannot be spent the way they wanted to spend it. So is that we have money, but we don't have money, and it's just those governance issues that I tried to talk about. Now, recently, another guideline was being developed. The former guideline that was developed with the National Health Act, which would have governed like the Basic Health Provision Fund, is still 50% of that money is still going to insurance. Now, the reason why it's not working very well, that the former minister discarded the guideline that came with the destiny and decided to do his own, And then some of us said that was illegal. We were ready to fight because I pursued the National Health Act with colleagues for 15 years. We had to mobilize 5,000 women to the march to the National Assembly at some point for them to pass the act. Because that is the sure way, the basic healthcare provision for is the sure way to get 50% of that income to go to the healthcare sector in terms of services at the primary healthcare level. 50% will go to insurance for vulnerable. But 45% of that money is supposed to go to the primary healthcare across the country directly. We ring-fenced that money so that no president can touch that money. It's a statutory allocation. No governor, no executive director, either at the federal or at the state level. That money has to go directly to the primary healthcare.
Okay.
Then 5% for emergencies. So this is the way we have been trying to use statutory allocation so that money cannot be. But beyond that, we need a wider level of insurance for the Nigerian people.
Thank you so much. Dr. Wunola, I'll direct this question to you. We would also like to have your perspective on the relationship between funding and effective management of healthcare services.
Against the backdrop that what Dr. JK has said is like there's no way a government can wholly fund the health sector.
Well, thank you once more for inviting me. Maybe, I'm sure you have used this expression severally. Throwing money at problems.
Yes.
So if we continue to, I hope I will not change the attention or the direction of this discourse. Because without order, without establishing the health system, even if we meet the Abuja declaration of 15% of the annual budget, there will still be chaos in the system. First of all, we need to go back what God has done through coronavirus disease. Some of us have been wishing that this country should be switched off. We gather people, eggheads, to say, how do we solve the problem? How do we solve this problem? Then we now gradually switch on.
That's what coronavirus appears.
That's what God allowed Corona to do. So the pastor saying, Magedon, the world will end. No. God decided to use it to teach us that sense. We don't.
So the switch off came.
Child, the prodigal son, to say, come back to order. So what do we need to do? Let us go back to that document called National Health Act. The beginning of that section, and before what gave rise to National Health Act? Professor Itari Lambo, let me take the history from there, was brought. A health economics was brought by President Obasanjo to be the Minister of Health. He commissioned a studied the whole environment, and he found out that there is no order, no system, not people do whatever they like. I said no. Given the backdrop that it is a well-known established dictum all over the world that health systems that perform better are those ones that have an overarching legislation. So the process started. So this document called the National Health Act, first of all, established the Nigerian health system. The various levels, national, sub-national levels. Try to allocate some level of...
We always have good documents.
Yes, responsibilities. Then the other problem was funding. That same document now created funding.
Direct
from the consolidated revenue fund, just like my senior colleague has said. So that you like health sector, you like the health minister or not, that's revenue. As long as Nigeria earns revenue, that revenue must come. And he said, I think that's why you brought us the cut.
Yes.
Not less than 1%. Meaning it can be from 1.001% to infinity.
Yes.
So they did the budget office of the federation that was making a claim that it's 1%. I refer him to that document again. The law says
minimum.
Not even, he said not less than, in very simple language.
Not less than 1%.
So if there is an area you are looking for how to cut money and so
not
on,
from there.
No, not from there. So that has begun to make people all over the world to say, wait a minute, these people, are they learning any lessons at all?
Are they serious?
Because but not less than 1%. Then he said donations. That's why we're even thinking the donations that came from corporate Nigeria for the COVID fund would have gone to fund that system, because just like you journalists keep on saying, there's no citizens of Nigeria apart from the few Abuja regional inhabitants. All of us are from states.
Yes, we came out from
states, local government, from local government communities, wards. And the health system of Nigeria recognized the ward health system. 1 PHC per ward. This document has even provided how funding could originate from that. So what am I talking about? We have not gotten it right. Little historical perspective. It is a pity that the very party, I've not come here to promote any party, Nigeria can say to be the Nigerian glorious days in health funding from 2011 to 2015.
Yes.
The highest so far in 2012, where we got to 5.8%. Since that time, just like you have, is it your family? You don't provide money for feeding. You don't provide money to school to train your children in school. You don't provide money. They say good soup.
Now money maker.
Now money maker. So we have abandoned funding the system.
Let's get back to the practical effects of how this is impacting. Like I said, the doctors are on strike, and we are trying to go back to the drawing board again, try to do what we ought to have done at the beginning. How much impact will this reduced budget, continued neglect for the funding of the health sector have on the management of the COVID-19 pandemic? How much effect is it having on it, and how much effect do we foresee it will continue to have? Maybe you just take a shot.
Yes, a very practical step. Now, let's there is one Mama Ngozi somewhere, or Mama Oke, or Mama Hassan, who has been attending antenatal because she's pregnant. Maybe she was told that the baby is lying abnormally.
Yes.
So may need operation if the baby doesn't turn. It's in one Nyanya PHC. Now, she entered into labor last night. And at arrival at the hospital gate, the PHC said, no, we told you we can't deliver here.
We have to go to
baby is coming
hospital
with the leg. We can't handle this here. Now, when he was referred to Nyanya Hospital, Nyanya Hospital said, you never hear say we dey strike. The gate is locked. Meanwhile, she has been having her antenatal and so on. Go and check whether Asokoro National Hospital of Gwagwalada
they'll go round.
She will go round. Meanwhile, labor has started. Before you know it, her womb will rupture. If she's lucky, eventually to get, maybe she will call her pastor or her imam. They will now call one private practitioner, where real money will be paid.
Yes.
She may be delivered, but she will end up with VVF. That is what. Or there is one little bosse who has malaria. They have gone to chemist to
we saw that on air yesterday.
To mix medicine.
Yes.
Say mixed drug for me. The drug they mixed for little bosse, Mama Bosse gave, but couldn't control the fever, and she started convulsing. The Mama Bosse couldn't, that Nyanya Hospital or whichever hospital is on strike. So this man said, "Oh, put oil, no, put changu leaf and so on." Before you know it, Bosse will aspirate distance into her lung and die. So this is how our citizens are dying. Every day we are talking of maternal mortality. We, Dr. Ejike, we know better than me. We are talking of infant mortality. We are talking of men. Look at the people having stroke these days. Any person that has stroke, if help doesn't come within the first 6 hours, you may not come out well. So this is how the people who have diabetes that need their refill of drugs, the hypertensives, those with asthma, the rainy season is coming. The hospital
it boils down to a big picture,
so,
a very big picture.
You
of
keep
a
on
problem.
asking me. Tomorrow you come out, they call you Your Excellency, the governor. You carry your babarega. You don't have shame. There is no primary health center. That is where a goat, proper big man's goat or dog can deliver. That is what you want your citizens. Each of these governors, go and check the primary healthcare centers in their communities where they come from. Can normal people allow their dogs to deliver there? So this is the nexus between poor funding, poor health services, very terrible health indices, very terrible development indices.
Right.
Okay. Dr. Ejike, I will direct this question to you now. We have over 30,000 primary health care centers in Nigeria, with most of them performing below expectations. Will this situation not be compounded by the reduced funding for the health sector?
Yes, funding, like we have already established, is a major component of a good healthcare system. It will impact. Remember the way I had already elaborated, where you have the leadership, the governance, the implementers, the monitoring and evaluation, and then funding when it comes to healthcare system, using that as a distance. So I like to disaggregate. The reason why you have to disaggregate, if you don't disaggregate, you won't know exactly where the problem is so that you can attack it. Leadership, National Assembly, the funding they are talking about is actually the Basic Healthcare Provision Fund. And the fund this year is 45.1 billion. And is tied to the income. All right? I've been trying to do the maths. If it's tied to the income, if it's 45 is reduced to 25, 28, the first question we'll ask, was it based on the fact that our oil earnings have come down? And if it's come down and we're using 1%, we still insisted on using 1%, then statutorily, the government has not done anything wrong.
The law says a percentage, this particular percentage, whether it is 3 naira,
yes,
20 naira, it is this percentage.
This is the percentage. So I'm trying to disaggregate that. When I disaggregate that, I will now come to make a very bold statement about that. Because like I said, some of us, 15 years of our life went into getting that out in place. Then the second thing is, the moral question will now be, which is I think what most people are asking. Even if it is, the Act says not less than 1%. So in an emergency here, it will now be preferable to say, because of the emerging problem that we have, let us increase the percentage and still get the money to the 45%, so that you still would be within the Act.
Yeah.
Because it's an actionable thing. If they go below 1%, that can take the federal government to court.
Okay.
Because it's an appropriation act. Okay? So, that's on one side. On the other side, remember, I'm going back to leadership and governance.
Yes.
The present government has said, through central bank, we are going to put, immediately that this pandemic broke, we are going to put aside 100 billion naira for private healthcare sector support. Single digits, 5 years moratorium before you start paying back the money, with a 10-year period to pay back. That's a bold step ever, the first time. That's leadership. The federal government also, through the Secretary of Government, has said, we are going to deploy 500 billion naira to the healthcare sector. That's leadership. But my problem is, this pronouncement has been made. The actors who are supposed to enable these things, how are they going to do it? What are they going to do? So for me, that's where we'll pay our attention.
Are they doing it?
Well, it's just been pronounced about a month or so ago.
Yes, if a month ago, if a baby is going to smile, you will know a baby will smile.
Exactly. So that is where we will now have to pay our attention. If the oil revenue has dwindled, the money going to the Healthcare Provision Act has dwindled, this 500 billion naira must be used to shore up those areas that the money has come down. I chair the medical subcommittee of COVID-19. We are doing projections, analysis, and simulations. What is going to cost the city of Abuja within the next 1 year? The little projections we've done already, it cost the government 1.7 million naira to treat one COVID-19 patient for 14 days on the average. We projected with the numbers we have, and we have not done proper trajectory. By the end of 1 year of COVID, city of Abuja has to look for minimum of 24 billion naira. Meanwhile, the total health budget of Abuja is 21 billion. You get the point. Now I'm talking about just the treatments and data. We're not even talking about the monitoring and then the testing, tracking testing, and then one test about 50,000 naira. So by the time you add all of that, we're talking about 50-something billion for just the city of Abuja.
When you reel out these
Figures.
statistics, I get the good people. So are we enabled? Are we serious?
This is what we have not completed. We have complete. That's the advice we're going to give to the minister. We're looking at different scenarios. This is the time to be innovative. Innovative strategies are the only thing. Every country in the world is on her knees. Every country. Except a few, maybe Iceland and New Zealand, who have come out of Koro. But every other country, even America, is on her knees. So this is the time, because we were starting from, like, in a 100 miles race, or 100 meters race. Others probably are 50 meters away. We are still starting from 1 or 2 meters behind. So it's going to take a long way to catch up. So it's innovative look at what we're going to do. And that's why data is important. Data. And that's why for activism, I always tell my fellow activists, when we're going to do activism on any issue, you need to drill down and get the data. When you get the data, you can now attack at the right place and make constructive input there. And then when you push back, it doesn't work, you push back more. Even if it's going to the streets, you do that. But we must find out where the problem is. And for me, health is on the concurrent list. Let's look at that too. The federal government cannot prescribe to the states.
Yes.
Most of these failures in the healthcare system is at the state level, the subnational level, states and local governments. You get the point. If you look at the healthcare system in the country, there are 3-tier system: primary, secondary, tertiary.
Yes.
The semblance of health you have in Nigeria is at the tertiary care.
The other
National,
ones are just,
they don't exist. So that's why I said we should be, when we call Buhari once in anything health, we should call the governors 10 times.
now that brings me to this next question. I wanted to also take it, sir. On Tuesday last week, the Minister of Health, a colleague of yours here, reaffirmed that many deaths in Kano recently were related to the COVID-19 outbreak. Now, do we have enough funds? Do we have enough seriousness? You have already painted the picture of how much is really required, and we are not looking beyond COVID-19 itself. Do we have enough fundings, political will, and the seriousness to diagnose, detect, and treat diseases before they result in deaths like what happened in any of our local areas?
I think you hit the point. It's not the issue of money. It's not the issue of capacity. It's the issue of political will. And I think that's what also he alluded to, Henry alluded to initially. Let me just segregate Nigeria for you. I come from a state where my governor was denying that there was no COVID.
Has he left isolation now?
I don't know. Until the commissioner died. Out of a cohort of about 250 people, 67 people were found to be positive. There are some states also who are saying they don't have COVID. Some people in development work are now getting positive, and they are trying to sneak to other states. In Abuja here, we are receiving people from so many states that are denying. Kogi here, we are receiving patients. Now, why I say that is the political will. If you look at the response to COVID, it speaks to that issue of political will. When COVID broke, the minister here, in his wisdom, set up an expert ministerial committee on COVID-19. Please help us put up a structure. Abuja has the best response because of that his goodwill doing what he has to do. Now we have about 1,100 beds for treatment and isolation in Abuja. Even if we have a massive surge, we have the healthcare system to take care of those patients. Now that is what I mean. That it's not about money. Kanu was in denial. Even Dangote donated money to support them. So it's not even the issue of money. It's the issue of articulating what you do, have a structure, have a strategy, and go after that. Because the first strategy we did in Abuja is to say, let us first make sure that we have enough beds. Because what is happening in the developed world is that the COVID-19 overwhelmed their healthcare system.
Yes.
They even have redundancy more than us. It overwhelmed, pure and simple. So the strategy here is test, isolate, treat. Remove those people from the system so they won't continue to infect people. Reduce the speed of infection so that at any point in time, the people that are ill, the healthcare system can accommodate.
All right, you heard Dr. Ejike Oji, yes. And he's also we also have Dr. Henry Ewunonu just also in the studios here, and it is an opportunity we always have every week to interact with you, to hear your own voice. Of course, the program Public Conscience is interactive, and we are not always happy if we don't have your input into it. So a lot of questions to ask. I know many of you must have gone to the hospitals and you are told go back. And so many fears about COVID-19 and the doctor's strike and a whole lot of issues, the budget, the dwindling budget for the health sector. I guess you out there, you are as knowledgeable as those of us in the studios here to tell us your own experiences and what you think we can do to improve the healthcare sector and bring it to a point where all of us will be happy that we have a healthcare system. And that will be, let's look at what can be done to get our listeners and the viewers into the studio.
Like Austin already said, you're on to Public Conscience on radio.
We have our first caller in here. Thank you for joining us. Your name and where are you calling from?
My name is Mr. Ed. I'm calling you from Otako. And kudos to our doctors in the studio there.
Thank you. Go ahead, please.
Yes, it is quite unfortunate that we are having underfunding to the health sector right now, up to now also. And also on the opinion that no doctor should ever resume to the office. Because right now, and my own advice is that no doctor should go back to the office unless they receive alerts on their phones. And I think with the doctors all over the country that they should be in one umbrella and speak with one voice. Not a few ones that will go back and collect the few change from their hands. Because they start to divide themselves. Let them speak with one voice and find on one agenda. Because
all right. We must quickly allow some others to get, but there's an argument that will be that some persons are arguing very seriously that this is not the time. The doctors are not considerate. This is why should they go on strike at this time? This is not the time. Of course, these are arguments that are also going. I know that Dr. Ewunonu will respond to that. Why the medical doctors are having that kind of bashing that they ought to be considerate. They should not be on strike at this time. Hello, your name, where are you calling from? Please make it as fast as possible.
My name is Ujala and I'm calling from Kubwa, Abuja.
Go ahead, please. Make it in 30 seconds if you can.
I appreciate what you people are doing, and I thank God that my friend Dr. Ewunonu is there. I want to encourage the doctors to stick on their guns. The government should be serious and regard these medical personnel as human beings whom they cannot promise and say and think that things should be normal as always. Thank you.
Thank you very much. And hello.
My name is Isaac Oga. I'm coming from Masaka.
Thank you so much, Oga.
Yeah, so what I want to plead with the doctor, I want to plead with them because Nigeria are going through terrible stress. And to add this strike again to it is going to double their pain. They should please have mercy on the innocent, not the government. Because if we want to think of the government of this day, no government of this country, we are not going anywhere. Because if you look at even as I'm talking to you now, do you know that people that retire even last year up to now they have not been paid? So there are a lot of pains. They should please have mercy and let them go back and still tolerate Nigeria until where conscience will come up. Thank you very much.
Doctor, you have two of them now. One saying don't go back, the other one saying please have mercy. So you want to react before we take the next call?
Igbo people say I don't care. It's when you are not affected. Mm-hmm. For the scenario I painted, if you have had a sick person in the middle of the night and you go to a hospital and they say, sorry, we're on strike, you will not know how painful it is. We thank all our listeners, even the last person said, we understand, but please, for the sake of people who go back. Nigerian Medical Association is not on strike. It's the Resident Doctors. The Resident Doctor Association is an affiliate, of course, the younger branch, so to speak, of Nigerian Medical Association. what led to the strike? In April, the Minister of Labour gathered all the healthcare professional associations. I was there, and the issue of protection. Today, more than 850 healthcare professionals have been
infected.
Yes, they're in isolated. They have been isolated. Some have died.
So
We don't have those things you see on television about hospitals abroad. We don't have those things.
So you face the virus totally without any protection.
We know that every country is suffering, but now after signing that document memorandum, what happened? That up to today, they say they are still. And I will tell you what happened. Revenue mobilization is there.
You just permit you go ahead after we have taken this call. Hello, please. You have 30 seconds. Tell us your name and where you are calling from, because our doctor is on fire. Okay, go ahead, please.
For me, I want to beg the doctor. Make the doctor just make them not try to resume what he will pay them. Because when woman be working, need to pay to survive in family. These people get family. They go to make it the first. They tomorrow need to help their family, but you don't take the pass through. You need to pay this crack like this to pay them on a resume work. Thank you, sir.
Yeah, another appeal there. Somebody saying that doctor should please go. Let's see if the next person is going to tell us your name and where you are calling from.
Well, my name is Mr. Chima, calling from Nigeria.
Please, Chima, go ahead.
Well, yes, we should understand that these doctors are human beings. Like the doctor sitting there now have said it, that so many doctors have died with regards to this virus. Yes, we had this problem when the Senate are approving the resolution. The health is more important. What stops them from using that money to settle these doctors first? They are human beings. We can feel the pain from the public. Anybody can face it anytime. Let our government sit up and settle this matter once and for all. We have money to settle these doctors. Bye-bye.
Thank you very much. I will also add that we have money to pay allowances, 14 million to each senator every month. That one has not been reduced. We have money to maintain about 8 presidential jets. Even if it's not flying, we don't have any problem. We don't cut that down. We have a National Assembly that is not falling down. No breeze has blown it. We say we must repair it. Even when we are dying, they are not cutting that down. We have a lot of vehicles. They have bought 5 billion. They used to buy vehicles for each member of those who are in the National Assembly. We are not cutting that down. So that is the challenge. We'll be coming to ask the Dr. Ejike to react. But let's just quickly take this call, possibly the last one. Hello. Thank you for joining us. Your name and where you are calling from.
My name is Michael.
Okay, Michael, go ahead.
Yeah, please. You see, this is what I've been saying about this country. This country will be good one day. And if revolution did not come into this country, we don't think we will expect anything.
I hope you are talking about a peaceful revolution.
Look at the money they were donated on this COVID-19 and order. And they cannot be able to use that kind of money to pay even doctor. Even the money we have in our accounts, if 2 generations come, they cannot finish it. They cannot consider the doctor. But I'm pleading doctor, they should not consider the government to have today. They should just please the masses. And those who does not even have nothing, and they are in those people dying, they should remember that whatever they do, the reward is in heaven. That is my advice, sir. Thank you.
All right, thank you, Adaobi. You know, we have always been talking about a revolution here. I have my own prescription. A revolution that must be led by the president, president and commander-in-chief. A revolution that will be led by the president and commander-in-chief will be most effective revolution. And when we talk about revolution, we are looking at changes to our system, change to our attitude, and the president can well really lead that, and the governors as well. Maybe Dr.
I would like Dr. Ejike.
Sorry, why wasn't it implemented? Because every other person went to sleep. Because in this country we have copied, I don't know where we copied this burgeoning bureaucracy from. Now government from their revenue mobilization will pass circular, or no, the Federal Ministry of Health will now pass originate a circular, a memo that will, because he may not write to revenue mobilization directly, we now go maybe through the head of service to the SGF or to the chief of staff. We now authorize them to send to revenue mobilization.
Maybe people are dying.
That's what I'm saying. So from April to June, nothing was done to implement.
The letter is still crawling.
The letter is still crawling. So where did we copy this thing from? Who did this thing to us?
It's like what?
Secondly, sir, last week, the House Committee of Public Account invited the PTF. They sent their permanent secretaries. And NCDC said, yes, we got about 5 point something billion. We have spent 1.2. The remaining is 3 point something. It's in our bank, safe. The PAMSEC, Foreign Minister of Health, said, we got 2.5 billion. Oh, we have not touched it. It's in them. The people said, I told you people say you are at war. We are giving you money to buy ammunition. What our soldiers will use. So remember, and what does this remind us? The parable of the talent, the one that went to hit the talent inside the ground.
Yes.
So people are sleeping while Rome burns. You send soldiers to the war front, and you don't, without ammunition. COVID-19, we have heard how infectious and how contagious it is. You send soldiers to the war front with catapult or without catapult at all. That is what the boys had. They said, our members who have died, who is taking care of their families?
Exactly. Those who are
so the insurance you promised, we have not seen even paper to sign, not to talk of implementation. Before Dr. Ejike, since he's now he's working for the Minister of FCT, can we ask the Minister of FCT through him why Utako Hospital that is up to 70% completed is still like that? Utako Hospital is directly opposite that junction of Utako Market. It's on the other side.
Yes.
That hospital roofed. Before COVID-19 came, Abuja used to be reputed for one slang, no bed space in our hospital. Carry from Karimo, you go to Gwaripa Hospital, no bed space. You come to Worcester, no bed space. You go to Maitama, no bed space. You come to National Hospital, no bed space. Meanwhile, yes, he completed the Zuba Hospital.
I hope we have enough
and the Rubochi. So what I'm saying is that let us identify critical sectors. What is the UNDP judging that when they say human development index?
Okay, let's get to Dr. Ejike.
Dr. Ejike, we would like you to respond to some of the questions raised by the listeners.
On one hand, they agree that the doctors have very good reasons to go on strike. On the other hand, they are saying, we know that is happening. Please, they say when the elephants fight, the grass suffers. You get the point. So for me, how do I respond to this sort of thing? Is to, like he said, if there was an agreement, please make sure that you activate that agreement. When we started the COVID work here, we told the acting Secretary of Health, if people do not have PPEs to do their work, it's like you're sending soldiers to fight an enemy that has a 106 howitzer gun, and you are giving them AK-47 machines, or you're not giving them at all,
it's not even
or even catapults. So at least that's exactly why I always like to disaggregate. There are responsibilities of the federal government, there are responsibilities of the states. For the money promised, I think that is federal government that promised that promise. So that blame goes to the federal government. But for PPEs in different hospitals, it is the responsibility of the governors. In Abuja here, I can beat my chest that there's enough PPEs.
At least you are involved.
Yes, we make sure there is always a good stock of PPEs for all the healthcare workers in Abuja. But you see, PPEs are not the only reason healthcare workers are getting infected. How you don and doff, that is how you put it on and remove the PPE, you can infect yourself. Training, IPC training, infection, prevention, and control. That training, retraining, and then supervising is the key. Now, in Abuja here, about 150 healthcare workers have been affected. And then majority of them are actually in the public and private sector, not in the isolation units. You see the importance of training and retraining. Yes. And that's why we have, with the Health and Human Service, we have developed a triaging document that you will use when a patient comes. You know how the patient will go, which one is suspicious, how are you going to make sure that that patient does not infect healthcare workers. Because if the healthcare workers keep getting infected the way we are going to be in crisis.
Exactly.
Because once, like we are here, if we are colleagues and I'm a doctor and I get infected, every other person here will go on isolation, quarantine for 14 days. That means everybody that is in that hospital,
Are left on their own, yeah.
you have to look for doctors from any other place.
All right, we just, unfortunately, the time is not permitting us to go ahead and to continue. Our time is up, and we have to wrap up now. Adaobi.
Please visit the news page of our website, news.primorg.org. That is news.primorg.org. For all the details of our reports and interviews, visit our website, primorg.org, to get all the information about Primorg.
And we always say that Primorg is spelled P-R-I-M-O-R-G. P-R-I-M-O-R-G. That is the spelling of Primorg, in case you are going to our website, primorg.org. We appreciate Dr. Ejike Oji, and we also want to quickly say that Dr. Henry Ewonon, both of whom have been here enriching at the discourse, want to appreciate them and thank them so very much for finding time out of their schedule, very, very tight schedule, to join us in the studios, hoping that both the government and the citizens and the listener, like all of us, will benefit from their weight of the discussions that we have had. Public conscience on radio is supported by the John T. and K3D MacArthur Foundation, committed to building a more just, verdant, and peaceful world. To get more about get more information about the MacArthur Foundation, please go to their website, www.macfound.org.
We want to encourage you to join us again next week for another episode of Public Conscience on Radio. I am Adaobi Obiabumo.
Let me just appreciate you, Dr. Ejike. Thank you for joining me on the program.
Thank you.
And Dr. Emmanuel, thank you for joining me on the program.
Let's learn this lesson.
Yes.
If we don't learn the lesson COVID-19 has taught us, there may not be another opportunity.
The switch on and the switch off that you talked about.
Everything is stopped because of one virus.
I said the virus is the good, the bad, and the ugly.
I'm Okiri Agbonsuremi. Please stay away from all the troubles and particularly stay safe, obeying all the instructions and the guidelines brought out by the government to safeguard you and the family and society from the COVID-19.